There we go. All right. Welcome to the Joint Committee of the Environment and Natural Resources, Wednesday, February 17th. Good to see everyone. I want to do a round of introductions as per usual, but before we step into that, I'm just going to give you all a little sense of what will happen today. We have two public hearings scheduled, one for Joint Committee of the Environment and Natural Resources. That's funny. One for LD 203, which we'll hear first, and then another public hearing for LD 8. What will happen is if you are here to speak for, against, or neither in favor or against, and you're in the waiting room, what I'll have you do is we'll have everyone who's here for the bill raise their virtual hand in the waiting room, and then I'll call on you. You'll be brought into the committee room, which is essentially the panelist space. You will feel like you might be getting disconnected. There will be a transition phase as you're being brought into the room, but you will arrive, and then we'll listen to your testimony. And then we'll place you back into the waiting room. I think that's it for housekeeping items. So let's start with introductions. Representative Ziegler.
Yes, I'm Representative Paige Ziegler. I represent the District 96, the 7 towns of Belmont, Liberty, Lincolnville, Montville, Morrill, Palermo, and Searsmont.
And Representative Johansson.
Good morning. My name is Chris Johansson. I represent House District 145, the 18 organized towns between Bridgewater and Sherman.
Representative Dudera.
Good morning. I'm Vicki Dudera. I represent House District 94, Camden, Rockport, and the island of Islesboro, where John Travolta lives.
Representative Gramlich.
Hi, good morning. Thank you, Senator. I am Lori Gramlich, and I represent House District 13, which is the lovely seaside community of Old Orchard Beach.
And Representative Bloom.
Good morning. I'm Representative Lydia Bloom. I represent House District 3, the coastal portion of York.
Representative O'Connor.
Good morning. I am Beth O'Connor. I represent the individuals of Berwick and North Berwick.
Representative Hanley.
Good morning. I'm Jeff Hanley. I represent District 87, which is Piston, Alna, Westcasset, and Randolph.
Senator Carney.
Good morning. I'm Ann Carney. I represent Senate District 29, which includes South Portland, Cape Elizabeth, and a little bit of Scarborough.
Senator Bennett.
Good morning. I'm Rick Bennett. I have the honor of representing 13 sparklingly lovely towns in Western Maine, the greater Freiburg area, the Oxford Hills, and the Lakes region of Cumberland County.
And my esteemed co-chair, Representative Tucker.
Thank you. My name is Ralph Tucker. I'm a state rep from Brunswick, House District 50, which is roughly half of Brunswick. Thank you.
And I'm Senator Stacey Brenner, and I represent most of Scarborough, part of Buxton, and all of Gorham, Senate District 30. And we're also joined by Sabrina Carey. She's our clerk. She keeps us organized, and our analyst, Dan Tardikoff, who helps us with all the things all the time. So I think we're going to go ahead and get started with LD 203, and we're going to invite Senator Moore to come in to introduce the bill. Welcome, Senator Moore. It's nice to see you this morning.
Good morning. It's good seeing all of you all. I wish we were here in person, however, but good morning. Senator Brenner, Representative Tucker, and distinguished members of the Environment and Natural Resources. My name is Mary Ann Moore, and I represent Senate District 6, which includes all of Washington County, along with Winter Harbor, Goldsboro, and Sullivan in Hancock County as well. I'm here today to present LD 203, an act to increase funding for the St. Croix International Waterway Commission. Before I get into the details regarding the bill, I would like to give you a little background about the St. Croix International Waterway Commission. In 1986, a memorandum of understanding was signed between New Brunswick, Canada, and Maine, signed by Premier Richard Hatfield and Governor Joe Brennan, to establish a cooperative program through their respective legislatures to jointly manage their common heritage river, the St. Croix River, and its adjacent lands and resources. I included a copy of the memorandum of understanding that had been scanned in with my testimony. The St. Croix River actually runs from North Lake in Orient to Passamaquoddy Bay in Perry, including East Grand Lake and Spednick Lake, covering nearly 110 miles. I actually live on the St. Croix River, or by the St. Croix River, in Red Beach, just outside of Calais myself. The initial goal of the cooperative program was to promote boating, canoeing, fishing, hiking, bird watching, camping, swimming, picnicking, ice fishing, hunting, cross-country skiing, et cetera, et cetera. In 1987, the Maine legislature and New Brunswick, Canada adopted similar legislation, creating the St. Croix International Waterway Commission, with 4 Canadian and 4 United States commissioners, designating a co-chair from each side. Members are appointed for a term of 2 years and are eligible for reappointment. I did include a copy of the Maine statute that established the commission with my testimony as well. And as you can see by the statute, the objectives of the commission are to protect and manage natural and recreational resources, current and future, encourage and maintain high-quality backcountry recreational and educational experience, encourage tourism leading to economic benefit to the region, protect and promote awareness of heritage, including Native American and early European, ensure coordination in planning and management of shared resources, assure fair representation of all users group, obtain optimal benefits from recreation and educational use of the resources. The statute calls for employing both Canadian and US citizens, sharing the cost of developing and management of the commission itself, staffed by line agencies from both Maine and New Brunswick. It also established 4 working committees to include land use, recreation, fish and wildlife, and non-recreational use. The statute charges the commission to develop a management plan every 4 years by consensus, along with an annual report and budget to be submitted to Maine and New Brunswick annually. The initial budget included $30,000 for an executive director and $15,000 for an administrative assistant, for a total of $45,000 US funds, including benefits. However, the US has only appropriated $25,000 per year for the commission. Currently, both Maine and New Brunswick appropriate $25,000 each to support management of the organization. Through the years, the commission has struggled to keep an executive director to oversee the organization, mostly because of the workload. Job duties, besides managing the day-to-day operation, include fundraising to maintain the recreational programs along the river. The commission currently operates a recreational program out of St. Croix, New Brunswick, which is directly across from Vanceboro, Maine. The 4 recreational crew members and 1 supervisor work the watershed from East Grand Lake to Baileyville, maintaining over 70 campsites, of which 28 of them are on the US side. And they also oversee all activities on the watershed. The workload is such now that it does require an administrative assistant position. LD 203 is asking for an additional $25,000 per fiscal year to allow the hiring of an administrative assistant who will help with managing and networking on both sides of the border to relieve some of the workload required of the executive director. New Brunswick has been asked to appropriate an additional $25,000 as well. This bill did come before the committee last session and was one of the bills, unfortunately, that died on the appropriations table. I will add as an added note, the $50,000 allocation has been included in the governor's biennial budget on page A474. Thank you, and I would be happy to answer any questions that you might have.
Senator Bennett has a question.
Thank you, Madam Chair. Senator Moore, good to see you this morning. Does the commission receive any funding from the federal government?
No,
Either Canada or the U.S.?
the U.S. side, they do not. The Canadian side, they do, of course, have quite a bit of funding. And I know that Elizabeth Hyslop, who's the executive director, is going to be testifying, and she's going to include some of those figures that is provided. All they get from the U.S. side is the current $25,000. Okay.
I'd love your perspective on this, but if you want to defer to Elizabeth, that's fine too. But I was wondering if you could shed some light on how the closing of the border because of the coronavirus, the pandemic, has affected the waterway and the use of the waterway.
And again, Elizabeth, I know we'll be able to answer that. However, I do know from my own experience that it really did not slow it down. If anything, it sped it up a little bit because it gave the opportunity for people to go camping on the river, outdoors, without having to wear the masks. And so I think they did see an increase in the actual usage of the river through this whole summertime pandemic.
Well, it's a spectacular asset, and I have fond memories of canoeing it. And thank you.
And Representative Bloom is next.
Thank you. Welcome, Senator Moore. Nice to see you. So I guess I just want, I'm a little confused. You say that it's already in the budget, or you say there's 30,000 in the budget already and you want to add the 25,000? I got that confused.
I'm sorry, I apologize if that was confusing. Currently, the amount allocated is 25,000 in the current, the existing biennial budget that we have. In the proposed biennial budget, they have added the additional $25,000 that we've asked for. So that would be the total of the 50,000, which is what this bill is asking for. But just in case it doesn't get approved in the biennial budget, thus I went ahead and put the bill in as itself.
Thank you.
You're welcome.
And Representative O'Connor.
Thank you. And it's wonderful to see you, Marianne. I miss you. But fortunately, my question was just answered. I was assuming that this bill was to fortify just in case the budget didn't pass. And good luck. Thank you.
Thank you.
And Representative Dudera.
Thank you, Madam Chair. Good morning, Senator. Again, right? Bright and early.
Yes.
Another story.
Yeah.
So are the Canadians, and I might have missed this, although I don't think I did, but are the Canadians also matching this?
What we did when I had the bill last session, we actually had a letter on file where they were going to match it. And you'll see in the bill, the text of the bill itself, this is contingent on the Canadian side of it actually contributing the $25,000 as well. And they're all supportive of it. We feel very confident in that. So it'll be 50,000 from each side is what we'll be looking at to support the operation.
Any additional questions for Senator Moore? Not seeing any. Thank you so much, Senator, for joining us this morning.
Thank you.
We'll bring in Elizabeth Hyslop now for testimony. Welcome, Ms. Hyslop. When you're here, if you could turn your video on, if that works for you. We always love to see everyone, but if that doesn't work.
I thought my video was on.
We can hear you though, that's good.
There we go.
Oh, wonderful. Hello, welcome.
Thank you. Okay, I'm going to start with saying I'm really, really nervous. So if I slur, please forgive me. I've never testified before a legislature before. Senator Brenner, Representative Tucker, and distinguished members of the Joint Standing Committee on Environment and Natural Resources. I'm Elizabeth Hyslop, Executive Director of the St. Croix International Waterway Commission, and I come before you today in support of Bill LD 203, an act to increase appropriations for the St. Croix International Waterway Commission. As a representative of the commission, I would like to take this opportunity to express our sincere appreciation for the support of this bill by Senator Moore, Representative Jenner, Perry, and Toole. The incredibly beautiful St. Croix watershed provides residents and tourists with recreational facilities such as boating, hiking, fishing, and many other outdoor related activities. Economically, the region provides employment opportunities in Washington County, Maine, and in Charlotte County, New Brunswick, including income for Maine guides and youth support sporting camps, such as the annual Boy Scouts camping trips. Additionally, the watershed provides for residential and seasonal property ownership and related taxes, hydropower for industries such as the woodland mill, and raw materials for the forest industry. The commission is a unique partnership between the province and the state to manage our common interests along the St. Croix River. In doing this, the commission collaborates with various state and federal government agencies, their Canadian counterparts, and other stakeholders such as the International Joint Commission. We manage a much sought after recreation program in the area and collect environmental data on factors related to the health and sustainability of the waterway. Recent projects include contracts to collect water quality samples at various locations along the waterway, to collect and identify fish traveling, to count and identify fish traveling up the St. Croix River through the Milltown Dam, and the completion of a project with the U.S. Fish and Wildlife Department to measure the migration of river herring. And there's been several other projects as well. Our organization contracts the personnel and services required to manage all our programs, and I'm very, very proud of our board and our staff. Over our 35 years, our operations have expanded to include recreational site management, environmental science data collection, and providing experiential learning opportunities for youth in both regions. 2020 imposed additional processes and constraints associated with the pandemic. Our recreation program, our most significant program, is well received by people literally around the world. Last year, we had campers from as far away as Germany, California, and Alberta, at a cost that I suspect would be much less than that would be incurred by the province and the state to manage these sites. We provide each with the upkeep of 75 recreational locations, including campsites, portages, and trails in Maine and New Brunswick. As Senator Moore noted, 28 of these locations are on the Maine side of the boundary. All of the sites in Maine are provided to users at no charge. In 2018, the Board of Directors had its resignation of its 5th executive director since 2011. With the support and assistance of Senator David Burns and Senator Joyce Maker, the Board of Directors reviewed our hiring process and recognized that the commission requires both an executive director and an executive assistant. One of each, one would be from the States and one would be Canadian. Working with the various levels of government, community members, and stakeholders in both countries represents additional processes and challenges that have proven to be insurmountable for a single individual. The turnover and understaffing resulted in the revocation of our commission, almost revocation of our commission status in Maine in 2018, the loss of our charitable status in both countries, and a very confusing financial situation. Senator Moore and Senator Burns were of enormous assistance in recruitment and preparing the original bill LD 450 for the 129th legislature. In 2018, when I accepted the position, one of my first tasks was to increase our representation in the US, and we moved our office from St. Stephen to Calais on January 1st. In April of 19, we hired a program director. I'm Canadian, and our program coordinator, or our executive assistant, had just graduated from Washington County Community College and is an American citizen. The two of us working together, we were able to successfully provide our services and programs during the transition period of my moving from the corporate and risk management industry to the nonprofit world. I needed time to become familiar with the Commission's processes, duties, and compliance requirements in both countries. In 2019, the focus was to develop policies and procedures that provided compliance, transparency, consistency, and accountability of the operations of the Commission. This was a tremendous endeavor and substantially more complicated than was expected, primarily because the depth of the disorder was not fully understood. By the end of 2019, our charitable status had been reinstated, all reports and filings were complete, and our accounting system was implemented to ensure transparency. This was in addition to completing programs and providing student hires from the University of Maine and University of New Brunswick, and providing them with experiential learning opportunities in environmental sciences. As well, we participated in the Homecoming Festival and had committee members of our students on the opening ceremony. In 2020, in addition to fine-tuning our processes, we started 2 new programs aimed to add additional community engagement activities and adapted to the pandemic restrictions. As we are all well aware, the struggles imposed by the pandemic were significant, including having to close our office in Calais for 6 weeks in April. It has been closed since October 1st of last year. Although we no longer utilize the space, we have maintained the lease and continue to pay rent in that location. The protocols and requirements of the pandemic have required us to create new safety protocols, and we have incurred additional expenses. There's been a long history of serious concerns that the Commission would fail and not be able to continue operations based on the very limited funding. In fact, there were periods of last year in 2019 that there was not sufficient funds for me to be paid. We believe the failure of the Commission to remain operational at a compliant and functional level would result in a substantial loss to both communities, our partners and stakeholders. Based on the perceived negative impact on our desired state sustainability, we are asking for your support in Bill LD 203 that we believe will ensure our long-term viability. As Senator Moore noted, the state and province each provide matching financial support of $25,000 annually. That amount alone is insufficient to cover payroll expenses for myself and the program coordinator, let alone office space and administration. With respect to the recreation program, the maintenance of the 28 sites in Maine, the Bureau of Parks and Lands provides $5,300 a year with no equipment, vehicles, or watercraft necessary to do so. It would not be possible to maintain these sites without the additional support of the St. Croix Spednick Waterway Endowment Fund that provides an additional $12,000 to $15,000 annually. By contrast, the province of New Brunswick, that has 47 locations, provides $98,300 and substantial in-kind support for the recreation program, including free use of the former GP Canadian headquarters near Vanceboro at no cost, including utilities, taxes, and insurance. They underwent a substantial upgrade to the facilities that was probably around $200,000. And they provide all of the equipment. So all of our lawn care equipment, our canoes, safety equipment, watercraft vehicles required to maintain the campsites in Maine and New Brunswick. They also provide youth employment funding. For illustrative purposes, the document that I sent earlier shows that the estimated revenue between the recreation program and our operational expenses is approximately $145,000 US. Sorry, that's the income, and the expenses are approximately $170,000. The history of substantial underfunding has resulted in extraordinary efforts by a single individual to manage the commission. As a result, the original assistant director resigned, staffing was reduced to a minimum, and there were significant errors. We ask for your assistance to ensure the smooth operation of the commission and to assist us so that we may be able to assist the province and the state in future projects. In previous years, the commission provided a budget and a management plan to the state and the province for approval. This process ceased in 2016 when the executive director at the time resigned and subsequent executive directors were unable to meet all the demands of the position. The commission is willing and eager to reinstitute this process to facilitate a dialogue and strong work relationship between the commission, the state, and the province. Your support of Bill LD 203 will provide greater security for the commission and assist this unique international partnership to meet these and many other requirements. The increase in funding would only go in effect if both the state and the province agree to increase at the same time. The province has agreed to increase, matching the US appropriations amount in February of 2019, 20, and January of this year. Thank you for your attention and consideration for this proposal. I'll be happy to answer any questions you may have.
Thank you so much. So nice to hear from you this morning.
Thank you.
Are there any questions? Senator Bennett.
Thank you, Madam Chair. Just to return to my questions for Senator Moore, Ms. Hyslop, how do you pronounce your name? I'm sorry. Is it
Hyslop?
Hyslop?
Hyslop. Yeah.
Nice to meet you.
It depends on what part of Canada you're from or what part of Scotland. Everybody does it different.
Okay, thank you. Number one, are you seeking any funds from either the Canadian national government or the U.S. federal government? And have you ever had any success in that?
The funds that we would get federally came from, we got $45,000 from U.S. Fish and Wildlife to do the project at Moosehorn Nature Reserve. And on the Canadian side, the International Joint Commission, which is the regulatory body that manages any international border along where there's dams. So they're a federal, and we get youth employment funding about $5,000 a year from the federal government. Other than that, none of our programs fall under a federal jurisdiction.
You're just trying to stitch it together however you can. Can you give me your perspective on the use of the waterway, and particularly, you know, I remember when I did it many years ago, there weren't as many issues traveling across the border, particularly post 911 and now during the pandemic or post pandemic. What do you see as issues for use of the waterway with respect to, accessing both sides of the river for a paddlist?
With respect to the restrictions on the border, that poses a problem right now where the borders are closed, because a lot of people will for us, we access both Canadian and US sites from some of the US sites. And if we had an incident last year where there was an American that was nearly drowned and ended up on the Canadian site, and it caused enormous complications. One of our biggest complications with the recreation program is the lack of funding on the US side. So the US side up around Grand Lake is used by a lot of guides. So we had one group count how many times they used our sites, and one youth group alone used our sites like 200 days, the equivalent of 200 days over the summer. And that was not including the Boy Scouts and that sort of stuff. So the pandemic, we did see a marked increase in the use of our Canadian sites. There's 3 provincial parks where you have to pay to stay, and we saw a significant increase there. We don't have any measurement tool for the free sites, which would be in Maine and in Canada. There was a lot of, it was a great way to get out and enjoy being locked up, basically.
Yeah, so just to be clear though, if I put in on the US side and take a trip down the river, can I access the Canadian side as well, or am I not supposed to?
Absolutely not. So if you were, like right now, that's an absolute no and vice versa.
Right.
In normal times, you would have to let your, the border closest to where you're going to get in, you would have to let them know that you were going to be accessing the Canadian side and have your passport with you.
Yeah. Okay. Well, thank you.
Any additional questions for Ms. Hyslop? I'm not seeing any. Thank you so much for joining us.
Thank you.
And thank you so much, Senator Moore. I think you both will head back into the attendee room now. And if anyone in the attendee room could, who is not listed with their actual name that they registered to testify with, if you could change your name in Zoom under rename, that would be helpful so we know who to promote when. That includes someone named environmental manager, and then there are 2 Jeff Gratwicks. So ideally, if one of them is someone different, if they could rename themselves. And then if there's anyone else here to speak for the bill, Mr. Wallace has a hand up. And we've also been joined by Representative Bell. So before we hear from Mr. Wallace, perhaps Representative Bell, you could do a quick introduction.
Good morning. Sorry I'm late. I had a little trouble navigating to the platform this morning, but here I am, and thank you. I represent District 47 in Yarmouth, and thank you.
Welcome. Good to see you.
Thank you.
And Mr. Wallace, we see you're here. So whenever you're ready, you can turn on your video and unmute yourself, and we look forward to hearing your testimony. There you are. There you go. Whoop. There you are. Welcome.
Yeah, do I have it? Okay, yeah. I didn't know where I was. Senator Brenner, Representative Tucker, and distinguished members of the Joint Standing Committee on Environmental and Natural Resources. My name is George Wallace, and I am the U.S. co-chair for the St. Croix International Waterway Commission. I speak to you in support of Bill 203, an act to increase funding for the St. Croix International Waterway Commission. I would like to take this time to thank Senator Moore and Representative Javner, Toole, and Perry for putting forth this bill for us. As you will hear many times today, the St. Croix International Waterway Commission, who I will call the Commission from here on out, was started in 1986. It was started by a MOU between our government and then Governor Joe Brennan and New Brunswick Premier Richard Hatfield. At that time, the funding was set at $50,000 from each side of the river. This was an executive. This was for an executive director, an assistant, and to fund an office. I do not know when the funds were cut in half or the reason why. When I came on the board in 2017, the funding was at $25,000 from each side. I was new to the commission and didn't know all that it did through the year. I asked the ED for some financial information and never received it. I could tell they were problems, but I was not sure what they were. Our then ED was trying to run the office, the rec program, the fish tagging and counting, and set on some environmental boards all at the same time. She finally resigned. It wasn't long before we realized we needed both an executive director and an assistant to keep up with the work. There was too much work for one person. Our then U.S. co-chair, Senator David Burns, and past commissioners spent many weeks sorting out and organizing what needed to be done before we could hire a new ED. Senator Joyce Maker was a tremendous help in preparing us to hire a new ED. She worked with us throughout the whole process. We knew to keep from getting into the same problems, we needed to get more funds and also an assistant. Senator Burns went to work getting a sponsor for a bill to increase our funds back to what they were in the beginning. I believe the first bill, LD 450, was put forth by Senator Moore and the Washington County delegation. This bill was approved but never funded. You will hear from our new ED, Mrs. Elizabeth Hyslop, today. She was hired in November 19th, 2018. She is a much better speaker than I am. She is more organized and detailed than I am. She'll tell you all the programs the commission is involved in. Programs like water sampling, fish tagging and counting, and also our river crew that works on the river, maintaining campsites and building new ones. Last year, our river crew came across 2 men who had tipped over their canoe and lost all their equipment. Our crew got them to shore, called for a truck, and took them to Calais. The next day, our crew went back down the river and found most of their equipment. Some things that Elizabeth will not tell you, before she was hired, we had lost our tax-exempt charitable status on both sides of the river because the proper forms had not been filed. The IRS was after tax information. We had just enough money to hire her. We have, both Elizabeth and the commission, worked hard to put the commission in order. We have both tax exempt and charitable status back. We know on any given day what our finances are. We know what reports need to be sent and when. Yet there has been times when our executive director has had to wait a week until there were enough funds to get her a paycheck. I say this to stress the fact that we need this funding. The commission is involved in many projects, many more projects than we were in 1987. With this funding, we can be assured of a stable administration office and the ability to maintain care of the river. We have been in talks with the state of Maine and the province of New Brunswick on a long-term project they want to do for them. Without a stable income to our administration office, we cannot look long range. If this bill is passed and funded, the provincial government has already agreed to match it. This commission is important to many people, from North Lake in Orient to Passamaquoddy Bay in Perry. 110 miles of river used by camp owners, homeowners, industry, fishermen, and canoeists. We are commissioned to see that it is taken care of for many years to come. We take this job very serious. Thank you for your attention and consideration of this bill. I'll take any questions if there are any.
Thank you, Mr. Wallace. And for the record, I would say you're quite organized in your sharing with us this morning. I appreciate hearing your words. Are there any questions for Mr. Wallace? Not seeing any. Thank you so much for joining us.
Yep, thank you.
Is there anyone else in the attendee space who's here to speak on behalf of LD 203? You'll want to raise your hand. Not seeing any, we'll move to folks that are in opposition to the bill. Not seeing any. And is anyone here to speak neither for nor against the bill? Not seeing any. Okay, I think at this time we will close the public hearing on LD 203. And I'm going to ask that we take a 3-minute break. And we'll be back at 10:47. 48, sorry, math. All right, we'll see you all in 3 minutes. Thank you. Okay, welcome back, everyone. So I'm going to pass the hosting role over to my co-chair, Representative Tucker. He's going to run the public hearing for LD 8. You're muted, Rep. Tucker.
Thank you very much. I guess it's not a good idea for the chair to be muted. We're here today for a public hearing in the following bill. It's LD 8. It's an act to support the collection and proper disposal of unwanted drugs, and it was sponsored by Senator Carney. And so we have about 10 different attendees. And before we start, I'd like to ask the attendees if they could just raise their hand briefly so I can know if they want to speak. I want to see how many speakers we have. Okay, let's see. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 6 people. Okay, it looks like this is workable. You can put, I'll put the hands down. Very well. Why don't we start off with Senator Carney. Senator Carney will give you a little more than 3 minutes because you're presenting the bill so we can understand it perhaps. But later on, once things start getting repetitive, we might try to shorten testimonies as it gets repetitive, okay? Senator Carney.
Thank you very much. And I just wanted to point out that we do have one legislator, the co-sponsor, who is, I believe, present to testify, as well as the Honorable Jeffrey Gratwick, who introduced this bill in the 129th. With that, I will say good morning, Senator Brenner, Representative Tucker, and esteemed members of the Environment and Natural Resources Committee. I'm Senator Ann Carney. As you know, I'm a member of your committee. I am pleased to be here before you today to introduce LD8, an act to support collection and proper disposal of unwanted drugs. LD8 requires drug manufacturers to create a safe, convenient, and accessible system for Mainers throughout our state to dispose of unwanted drugs. This bill furthers state policy adopted in 2009 to promote product stewardship in order to protect the health, safety, and welfare of Maine residents. That policy is encompassed within Title 38 MRSA Section 1772. Maine urgently needs product stewardship for unwanted drugs. Efforts to reduce overdose deaths, expand treatment and recovery efforts, and begin a focus on prevention have been hampered by the COVID-19 pandemic. In Maine and nationally, drug overdose deaths have increased, due at least in part to the effects of the COVID-19 pandemic and related mitigation measures, such as isolation, avoidance or difficulty accessing medical services, and alterations in the illicit drug supply, according to the Maine Attorney General's most recent quarterly report. An analysis of the Federal Drug Enforcement Agency drug take-back programs, published just last month, noted literature suggests that many kids are not getting controlled substances on the street, but in medicine cabinets at home. If you look at the Maine Drug Enforcement Agency website, 2 pieces of information will jump out at you. First, the 19th National Drug Take-Back Day was canceled in April due to the pandemic. And secondly, and this is a quote from the site, the majority of teenagers abusing prescription drugs get them from family and friends and the home medicine cabinet. Product stewardship for unwanted drugs will also protect Maine's water supply. We know, based on excellent studies by the Maine Department of Environmental Protection and additional work by the U.S. Geological Survey, that pharmaceuticals are present in the leachate that is discharged from municipal landfills and in groundwater impacted by closed municipal landfills. This means that the unwanted medicine we throw in our trash cans ends up in our river and groundwater. The DEP has identified antibiotics, steroids, antidepressants, and anticonvulsants among the pharmaceuticals of concern. Similar problems arise when pharmaceuticals are disposed of in sinks and toilets. The USGS notes that wastewater treatment facilities do not treat for pharmaceuticals. And I just want to make a note here that I've provided a version of my remarks to the committee in a PDF with hyperlinks so that you can connect to the underlying data if you'd like. We can keep unwanted drugs from contributing to substance use disorder and from contaminating our water by adopting LD8. 6 states and many municipalities have enacted product stewardship programs for unwanted drugs. These programs have proven to be a safe, effective, and inexpensive way to address public health and environmental harms posed by improper disposal of unwanted drugs. You're likely aware of our semi-annual drug drop-off programs that local law enforcement agencies hold and may be asking, why aren't these acceptable solutions? Well, there are several reasons. First, those annual or semi-annual drug drop-off programs create significant delays in the disposal of unwanted drugs because they operate for just a few hours, just 2 days a year. A pandemic, weather, and scheduling conflicts can prevent patients from using those drug drop-off days. Even when the programs run perfectly, patients have to keep unwanted drugs in their homes for up to 6 months, during which they could be stolen or misused. Decreases in municipal revenue during the pandemic demonstrate the importance of addressing this as a manufacturer responsibility rather than a municipal government responsibility. A system for dropping off unwanted drugs anytime a pharmacy is open is a win-win. It's much more convenient for patients, and it brings customers into a retail establishment. So you may have noticed, and I've got it right here, that LD8 is a long and seemingly complex bill. I will explain how the bill came to you first, and then I'm going to walk you through the bill in a way that breaks it into understandable chunks. The Honorable Jeffrey Gratwick presented the drug take-back concept to this committee in 2019. Then LD 1460 underwent significant discussion and work between the initial hearing in April of 2019 and the committee's vote in March 2020. The amended bill that emerged represented the combined work of many stakeholders, including representatives from the Retail Association of Maine and the Consumer Healthcare Products Association. The committee unanimously supported the amended version of the bill, which is the exact language before you today. So now I'm going to turn to the language of the bill itself and explain the component parts. And I don't know if you have the bills before you, but what I'll do is just point to the page and line number so that you can kind of follow along. So first of all, from page 1, line 7 to page 3, line 25, LD8 requires drug manufacturers to operate a program approved by the Maine DEP to collect, transport, and dispose of prescription and non-prescription drugs that people and pets use in a household setting. The manufacturers can work together to operate a program jointly. So that's the kind of initial concept of the program. If you look at the rest of page 3, line 26 to page 5, line 37, you'll see that LD8 sets out the requirements that a program must meet in order to be approved by the DEP. Some of the requirements include that the program must accept all covered drugs regardless of the manufacturer and provide free, convenient, and ongoing disposal opportunities throughout Maine, including in rural areas. Information about the opportunities for safe disposal must be available on a publicly accessible website. So there's like one place that the public can go to learn where they can drop off unused and unwanted drugs. And then the program must implement outreach and meet awareness performance goals. So again, the object is to really help people understand the danger of the ways that we are currently disposing of drugs by either putting them in landfills or flushing them or dumping them down sinks, and to help people comply with the program. Then moving on, page 5, line 38 to page 6, line 13, manufacturers must bear the cost of the program and will agree among themselves how to fairly allocate costs. And then looking at the next element of the program, which is page 6, line 23 to page 7, line 30, collection of the covered drugs must follow procedures that are secure from diversion and are also environmentally sound. Destruction packages are not permitted. Mailback systems may be provided upon a patient's request, and the expense of services related to collection, such as collection receptacles and mailback envelopes and educational brochures, those are borne by either the manufacturer or by the operator of one of these joint programs. Moving on to the next element, which is on toward the bottom of page 7 through line 44 on page 8. There are detailed reporting and assessment requirements for the program in order to ensure that it's operating smoothly. On page 9 at the top, there's an indication that the DEP is authorized to engage in rulemaking to implement this program. There is a mechanism on page 9 for manufacturers and programs to resolve disputes among themselves for fair allocation of costs. The DEP will provide an annual status report to this committee, which may report out legislation to continue to improve and implement the program. That is found on page 9 and at the very top of page 10. And then finally, as far as rolling out the program, manufacturers have 6 months from the effective date of this statute to present their plans for a program or a jointly run program to the DEP. And that's found toward the top of page 10. The drug take-back program created by LD8 will work for Maine. We have all listened to the devastating news about the worsening opioid epidemic. We have also recently sat through an alarming presentation about the prevalence of PFAS contamination and the extensive cleanup costs. Now is the time to act if we want to prevent improper use of drugs and keep antibiotics, steroids, and other pharmaceuticals out of our rivers, lakes, and drinking water. Thank you for your attention this morning. I'm happy to answer your questions.
Questions? Does anyone have a question of the sponsor? That was very thorough. Yes, Representative Gramlich.
Thank you, Mr. Chair. Thank you, Senator Carney, for your very thorough review of this piece of legislation. I know that obviously those of us who were on the committee last session understand that Senator Gratwick had proposed a similar piece of legislation. And I'm just curious, I know that he had done quite a bit of work reaching out to vested parties and stakeholders. And we worked this bill, in my opinion, pretty extensively. So I'm just kind of curious, Senator Carney, if you had done that same kind of due diligence in terms of reaching out to vested parties and stakeholders in terms of their reception to being able to implement this. I think it's a critically important piece of legislation. I'm really very pleased that you and Representative Hymanson have introduced it.
Thank you.
Reintroduced it.
Thank you. Well, I've worked with Senator Gratwick, of course, on the bill, and then also did have several conversations, and I'm terrible at remembering acronyms, but several conversations with the Product Stewardship Organization, with the Retailers Association in Maine, and with the Consumer Healthcare Products Association. I've also had one conversation with the Maine Chiefs of Police, and we're sort of exchanging some more information about where they will stand on the bill. The retailers and the home healthcare products, and I believe they are testifying here today, they're going to have some suggestions for amendments. And we weren't able to fully vet and address those, but they have my ear, I'm listening, and do really want to work to further refine the bill if needed to make sure that it can be implemented in a easy, cost-effective, and most importantly, public health and environmentally effective way. So those conversations are ongoing.
Thank you, Senator. I look forward to hearing from those folks and hopefully that we can all kind of coalesce around this because, as I said, I think it's really critically important. Thank you.
Thank you.
Very well. Can we move on now, please, to the Senate the House co-sponsor, Dr. Hymanson. And we're going to promote you to panelist status. While the doctor is going through the circles, I'd like to ask the person who's listed on the attendee list as environmental manager if they could please identify themselves as to who they are. on the panelist list. Thank you. Senator. We're here on LD 8. Would you like to say something?
She's a
Go ahead.
representative.
Go ahead, Representative Hymanson, sorry. Since you've been on the Appropriations Committee, I assumed you must have been a senator.
Well, thank you. It's great to see everybody, old friends, new friends in this wild time. I have two computers set up. One is on AFA and the other is on you. I don't even know how I'm doing this, but here we are. I look forward to seeing everybody in the future. Boy, do I really. So good morning, Senator Brenner, Representative Tucker, and members of the Committee on Environmental and Natural Resources. I'm Representative Patty Hymanson, representing House District 4, which is parts of York, Wells, Sanford, and all of Ogunquit. I'm speaking in favor of LD8, an act to support collection and proper disposal of unwanted drugs. As a neurologist in private practice on the Seacoast since 1988, up to 6 years ago when I closed my practice and ran for office, I have watched people be unsure of what they should do to dispose of unwanted medications. Some have kept them in overflowing drawers, flushed them, crushed them, trashed them, or brought them to my office. Over the years, police stations have scheduled drug take-back days or bins in the stations with DEA agents driving the stockpiled unwanted meds to Massachusetts from York, as an example, to be incinerated. Some states have tried composting as an alternative to incineration. As a legislator, I have tried to find a way for nursing facilities to ship individually wrapped unwanted meds to a charity pharmacy for distribution to those who cannot afford meds, but the logistics and staffing costs have not been favorable. People can buy plastic packets called drug deactivation systems to empty pills, liquids, or patches into, fill with water, then dispose in the trash. These cost a person $8 for a 90-pill container, and the person has to know about them and order them. Some are given out with certain prescriptions. The containers are called environmentally friendly by the manufacturer, but they are not environmentally safe. These medications are bought by the consumer, are owned by the consumer, but unlike other consumer purchases, how should the consumer be responsible in the manner they are thrown away? There has to be a system in place to let people know how to dispose of unwanted medications so they do not harm the public. Someone needs to pay for that education and disposal system. Right now, to my knowledge, it is the consumer, the government, which is the consumer, and possibly some pharmacy chains who pay. Unused prescriptions for drugs can lead to misuse, accidental poisoning, introduction of pharmaceuticals into water sources, and potentially into drinking water. The unwanted product can harm, and the cost of cleanup should be borne by the responsible pharmaceutical companies with a standardized system with built-in accountability. I would ask the committee to look at the Massachusetts, Washington, and California programs. Make sure the program is not written to be so cumbersome the program becomes a new problem. And consider who should be the stewards of these products that create public harm. Thank you for your consideration.
Thank you very much. Do we have any comments or questions from our panel?
Yes, I do.
Go ahead, Representative Hanley.
Thank you. Thank you much. Representative Hymanson, thank you. And I'm sorry I didn't hear all of the presenters' original, Senator Kerry's original presentation, but I have a bunch of questions, if I may. And other states have this program in effect now, or a program very similar to this? And If so, do we have any feedback on how successful or cumbersome it is in these other states?
I know that Massachusetts, Washington, and California have current programs. They're new, and I don't know about their success.
Do we know of any, if I may, Representative Tucker, another question? So we don't actually have any true feedback on a successful program in another state? Is that where we are with this?
No, it's out there. I just don't know it.
Okay.
You might want to ask about that.
Yeah,
And get
I
that
think
information for your work
maybe
session.
for the work session, I think that's something we should know. I will say that, if I may, Representative Tucker, again, continue. Last year, my brother passed away and he had quite a few drugs because of his condition. And I had no problem getting rid of those drugs. I took him to the Gardner Police Department. They had a collection box and with no issue. So I sometimes wonder if what we're going to create isn't worse than if we have a system that's in place that's working now. Why would we create something that will duplicate it? And because always my worry about when you do things like this, if there's a cost associated with it, we all know the customer will pay for it sooner or later. That's how that goes. The cost of drugs will be affected. So I think we ought to analyze all of it. But, and because how do we, if we put this law into effect, how will we have a true measurement of success? Because I mean, I have drugs at my home and you can't make me throw them away. They're just there. Sooner or later, I'll get rid of them when I don't need them anymore. But so how will we actually truly measure the success of this type of a program? Is that, are we going to be able to do that?
I can approach those questions, and I think from my knowledge, somebody's paying for those programs now, and it's us, and it's our state governments and our local governments. So example, in our local police force has the bin for Drug Take Back Day, and then there's a DEA officer who once a year takes the stockpiled, and those drugs are stockpiled in the police department in a separate room under lock and key. And then they physically drive them down with a DEA agent to an incinerator in Massachusetts and incinerate them. So those costs are borne by our local government and people. So the cost is borne by somebody. This is a bill that asks the pharmaceuticals industry to take over that stewardship and take over that cost as a way to, because they should own some of the responsibility for the public health. So that's that part. The other, I'm sorry, I forget the other question was about, making sure that there's accountability. And in the bill, there is an accountability measure. And of course, you keep your medications until they're unwanted. And then when they're unwanted, what do you do with them? So that's the issue. And everything's about payment. Who's going to pay for something and take responsibility for it? And this is a bill that puts the responsibility for the payment onto the pharmaceutical companies rather than the consumer and our government.
Okay, thank you very much. Representative O'Connor has a question.
Yes, thank you. It's lovely to see you again, Patty, or Representative Hymanson. My question is, so with this program, would this just be prescribed drugs? Because it would seem rather confusing if this also included over-the-counter drugs, whether it be ibuprofen, allergy medicines, things like that. And I also would like to echo Representative Hanley's concerns, knowing that this will probably increase the cost of pharmaceuticals. I know right now we're having some big problems with that, with insulin has really skyrocketed and some other drugs. And I would hate to see that be a consequence of this. Thank you.
No, I don't know the nuts and bolts of the bill enough to, you'll have to dive into that about what types of medications. I know that that's listed, but I just forgot them. But somebody's paying for this now. And it's us, it's the consumer, and it's our state governments that are paying for it now. So it's really a shifting of that responsibility. So it's already being paid for. It's just the responsibility for it. And I think that's a threat that the pharmaceutical industry puts over these kinds of programs. And I'd ask you to explore that in your work session when you talk to the pharmaceutical industry and ask them directly.
Senator Carney.
Thank you. I just wanted to address some answers to those questions. And thank you, Representative Hymanson, for taking up the question. So on the issue of whether non-prescription drugs are included, they are included because they present the same environmental hazards that prescription drugs present. There is, and I think you'll hear from a veterinary advocate raising a concern about including some veterinary medications, and that's something that I didn't have a chance to look into, but will look into. I did want to point out that I believe the statistics or the data on cost is that it's less than 1%. I mean, less than 1 cent for every $10 of the value of medication. And in addition to that cost, if you compare the cost of running a stewardship program to the volume of money that pharmaceutical companies spend advertising, the advertising dollars really dwarf any of the product stewardship dollars that would be spent on this program. And then finally, I did want to point out that the cost is a really serious issue. And this is, as Representative Hyman said, about shifting the cost away from state and federal government to the companies. But in addition to that, and what I love so much about LD8 is that it allows manufacturers, pharmaceutical companies as a whole to operate one joint program that covers the entire state. And so it's actually an extraordinarily efficient way to bear these costs of keeping the drugs out of the hands of people who might misuse them and keeping them out of our water supply.
Thank you, Senator Carney. I might point out the model rules and the committee rules indicate that the sponsor of the bill should not engage in too much questioning of the witnesses. But however, some of these philosophical issues were brought up, and I understand that there would be a temptation for us to get into a debate back and forth between the committee members and also the witnesses. Perhaps we could defer some of that more philosophical debate for the work session and use the public hearing as the opportunity to do what the name implies, to hear from the public and ask questions which are for clarification purposes rather than to set up a debate. Thank you very much, Representative Hymanson. Let's
You're
go
welcome. Thank
next.
you for letting me be here.
Sure. No, it was wonderful to see you. Now let's hear from Senator Gratwick. See if we can get him in here. Promote to panelist. I'm pushing the button.
Representative Tucker.
Yes.
There's one question from Representative Graham, like she's had her hand up for some time.
Oh, I apologize. I missed it. It blended in with the books in your background. Go ahead.
Thank you, Senator Brenner and Representative Tucker. This may be something certainly for the work session, but it kind of piqued my curiosity a little bit in follow-up to Representative Hanley's questions. I'm curious if we can get the answer now or for the work session, if we have any data concerning the overdose rates relative to undisposed or properly undisposed medications. And I'll save my commentary for the work session, but I'm sadly intimately aware of an overdose death of a very close family member who got into medications that were not disposed of. that sat in the medicine cabinet. So I'd love to get that kind of data if we're able to for the work session. Thank you.
Thank you very much. That's exactly the kind of point that our analyst will take down and make sure that it's pursued at the conclusion of today's hearing. We'll have a list of things that each committee member wants to find out. Now, what is going on with Senator Gratwick?
Senator Gratwick here. Can you hear me, Representative Tucker?
We can hear you, but we can't see you.
Well, I have difficulty seeing myself as well, but I'm going to go ahead and just speak. And very briefly, I'll try and stick within your 3 minutes. But first of all, thank you, Representative Tucker and Senator Brenner. I'm Jeff Gratwick, and now still of Bangor. I want to thank Senator Carney for bringing this forward. And I have to say that this has been a project that I've been working on since I was on the Bangor City Council in 2009. This bill is a direct consequence of the opioid task force that was in the 128th legislature. And that resulted in the Office of Opioid Abuse, now under Gordon Smith. And this particular bill was one of the recommendations of that committee. I have three things to say very briefly. One is that the unintended consequences of medicine are very real, and I think you've all heard, and I have a detailed note that I've given to you already prior to this, that 70% of people with opioid abuse, drug abuse, seem to have started in their, for medications available at home, and this data has a reference there. And so getting medicine out of the home is very important, number one. Number two, the specifics of this, the devil is always in the details. And I have to say that the pharmaceutical and manufacturers have been very forthcoming on this. There's still a few details to be arranged, but this went back and forth in this committee about 12 times as we got more data, and I suspect there'll be more available. But the issues there are, one, should we have kiosks? Should you have mail back? Or should you have these product destroyers? And we made the kiosks, or those that you see at police stations. They're basically a metal post office box equivalent, bolted to the floor. They're within the pharmacy safety zone. They are organized and paid for. These are a very inexpensive way to take back medication. And as Senator Carney said, 1 cent for every $10 of a prescription. When the manufacturers say, this is going to increase the cost of medications, please do realize that pharmaceutical manufacturers spend more money on advertising than they do on research. More money on advertising than they do on research. So yes, they may have to cut back somewhat on their advertising budgets, but there's no evidence they'll have to do that. This is 0.01% of their money spent will go to these taking care of kiosks. The mail back envelopes are more expensive, anywhere from $7 to $25 per pound, whereas kiosks are $2 a pound, $2 versus $7 to $25 a pound. And the product destroyers can be up to $130 per pound. And as has been said, they make it medicine so it won't be ingested, but they don't destroy the molecules. You need to burn a molecule at 2,300 degrees in order to fully destroy it. This cannot be done here locally, for instance, in Maine at the PERC plant, but it is done either in Massachusetts or North Carolina. The third issue we dealt with was the quote convenience standard. Where should you have the kiosks? And those of you who are on the committee before will remember that I presented some Excel spreadsheets that went on. There were many, many miles of Excel spreadsheets trying to figure out, should this be number of kiosks per population, per area, whatnot. Because eventually it got so complicated worthy of medieval scholastics. It was a very complicated format, and the long and short of it, agreed to by the pharmacy groups, that having part of your license to run a pharmacy will be having this some take back available, whether it be a kiosk, which is the most cost effective for you, or mail back envelopes in case you don't have the room for such. And I've gone around to various pharmacies here in Bangor, and those seem both acceptable to the pharmacists. So those are my 3 points, and simply very briefly, I could comment. Actually, let me ask Representative Tucker, shall I comment on some of the answers to Representative Hanley's questions? Is that appropriate now, or would you rather have that later?
Oh, why don't we do that some other time?
Thank you, Brent. Then that's all I have, sir.
Okay. Are there any questions for former Senator Gratwick? Thank you very much. We have called up next the Department of Environmental Protection. Is the gentleman from the DEP popped up yet? Thank you, Dr. Gratwick. We're going to be moving you back into the list of attendees shortly. Okay, let's hear from the DEP now. Go ahead.
Good morning.
Good morning.
Senator Brenner, Representative Tucker, and members of the committee. I am Brian Beneski of the Bureau of Remediation and Waste Management, Division of Materials Management at the Department of Environmental Protection, speaking in support of LD8. LD8 would establish a product stewardship program for pharmaceuticals. Pharmaceuticals are a good candidate for product stewardship as gauged by the criteria set forth in the state's framework law, MRS 38, Section 1772, and the structure of the proposed bill will likely work well for this product category. The department supports the bill because of the detrimental impacts of improper disposal of pharmaceuticals on both human health and the environment. In 2019, the department testified in support of an earlier version of this bill, LD 1460, an act to support collection and proper disposal of unwanted drugs, sponsored by Senator Gratwick. A number of work sessions were held and revisions were made to the bill. Ultimately, LD 1460 was passed out of committee, ought to pass as amended, but was not acted upon by the full legislature due to the early adjournment in response to the COVID pandemic. The public health argument for proper disposal of pharmaceuticals is strong. A 2015 study published in the U.S. National Library of Medicine, National Institutes of Health estimate that 2 of 3 prescriptions dispensed go unused. Unused medications may be left sitting in medicine cabinets where they contribute to accidental poisonings of children and are available to potential abusers. In 2013, 18% of Maine high school students reported having misused a prescription drug during their lifetime, and more than 1 in 3 Maine parents felt their teen would be able to access prescription medications at home without parental knowledge. Common disposal options like sending unused medications to landfills or through wastewater treatment systems result in the release of these chemicals into the environment. A study of the Seattle area seafood performed during the spring of 2018 detected opiates, antibiotics, antidepressants, chemotherapy drugs, and heart medications. Because shellfish lack the ability to metabolize these chemicals, they can be passed on to humans that consume them. In addition, an Associated Press investigation found pharmaceuticals, including antibiotics, anticonvulsants, mood stabilizers, and sex hormones in the drinking water supplies of at least 41 million Americans. It is known that pharmaceuticals in the environment are having toxic effects on marine animals and fish. The case for pharmaceutical takeback has been strengthened by the connection between prescription opioids and opioid abuse. In response to the opioid epidemic, a number of Maine entities have begun pharmaceutical take-back programs. Although these appear to be doing a good job and are free, money to cover the costs of education, outreach, and collection is very limited. The establishment of a product stewardship program for unwanted drugs could integrate existing collections into a more widespread network and ensure ongoing funding. Sufficient education and outreach and the availability and convenient collection are particularly important to effective implementation of product stewardship for pharmaceuticals, because the environmentally detrimental disposal alternatives like landfilling and flushing are free and easy. These options have been, and to a certain extent still are, promoted as acceptable disposal methods by the FDA and others. The required education and outreach in LD8 will make consumers aware that landfilling and flushing should be avoided. An emerging issue in other parts of the country with pharmaceutical product stewardship is the need to coordinate programs when groups of manufacturers decide to work with different stewardship organizations, which result in the operation of multiple stewardship programs. In order to promote quality and fairness in operations in such cases, the department recommends revisions to allow the allocation of costs from one program to another when a program is underperforming. This could be completed by revising the last paragraph in Section 5, costs, to read, when two or more manufacturers participate in a stewardship program, or if multiple stewardship programs exist, the costs of implementing, administering, and operating the programs must be fairly and reasonably allocated between each participating manufacturer so that the share of the costs that is allocated to each manufacturer is reasonably related to the market share of covered drugs that the manufacturer sells in the state. A requirement to report on this market share would also need to be included in Section 10, Annual Reporting Requirements, by adding the requirement L, an analysis of market share of covered drugs by manufacturers in the state, and any other additional information required by the department for determining appropriate cost share. These changes, in concert with existing department rulemaking authority, can ensure that high-functioning stewardship programs do not bear and pass to their supporting manufacturers a disproportionate share of collection and disposal costs. For your reference, I have attached to my testimony a copy of this bill with the suggested changes shown with edit marks. Thank you for the opportunity to provide our comments. I will be happy to answer any questions that you might have.
Thank you very much. Any questions from members of the panel? I hope my comments earlier didn't scare people away here. Even Senator Bennett hasn't got a question. Okay, thank you. The next person that we're going to be calling is Sheriff Joyce, if he's listening. Mr. Boneski, thank you very much.
Thank you.
I think we've noted down your two recommendations and we'll be considering them at the work session next week.
Thank you very much.
You're welcome. You're now going to be moved back, okay?
Okay.
We're waiting for Sheriff Joyce. Sheriff Joyce, are you there?
I'm here. Can you hear me?
Yes, I can.
All right. I'm trying to figure out how I put my picture on here. So
now, if it's a little black rectangle, you go to the bottom over to the left, and there's a thing that says mute, and then there's a thing that says stop video or video.
I can't even find myself on the chart here. Hold on a sec.
Find that button.
That's why I didn't get into IT.
Yep. The button is right below the picture of Representative Gramlich. Oh,
we good now?
With Chris Johansson. Okay.
You got me?
We're here. Welcome.
Right. Good morning. Good morning.
Welcome to the ENR.
Senator Brenner, Representative Tucker, distinguished members of the Joint Standing Committee on Environment and Natural Resources. My name is Kevin Joyce. I'm the Sheriff of Cumberland County and immediate past president of the Maine Sheriff's Association. The Maine Sheriffs have unanimously decided to support this bill. A little background, in 2010, the Federal Drug Enforcement Agency started the national program of drug take back. And resident agent in charge for the state of Maine, Michael Wardrop, who was assigned to DEA, it still is, really worked hard with local, state, and county law enforcement to make this a successful program throughout the state of Maine. We do it twice a year, although with COVID, we had to cancel out last April, but we did do it in October. This was a phenomenal process the first time we did it. And about a year into it, the federal DEA decided to step back and get out of the drug take back for at least 1 6-month period of time. So the Maine Sheriff's Association decided this was an important project to continue on. So for that one take back, we picked up the ball and made sure it happened throughout the state. So for 10 years, we've done it twice a year, with the exception of April of 2020. All 16 counties, all law enforcement agencies, very few, there are probably 1 or 2 that do not participate in this biannual event, which I think is an unbelievable community policing event as well. You know, for 10 to 2 on a Saturday in April and October, we collect unused medications. You know, the Sheriff's Office of Cumberland County has worked really well with Mike Wardrop, who is really the mastermind of this big operation, because he's got it figured out logistically that it's a hub and spoke. If you can picture medications being collected in Aroostook County, Washington County, Hancock County, and Piscataquis County, being collected from 10 to 2 on a Saturday, boxed up and then taken to Penobscot County, where a tractor-trailer truck picks up those medications. And then they come down and stop in the Lewiston, Auburn area, where all of the adjoining counties truck their medications there. And then everyone around Cumberland County trucks the medications here. Portland becomes the actual stopping place on Saturday night of drug take back. The Cumberland County Sheriff's Office, we have police volunteers. So all of the pre-planning is done by Mike Wardrop at DEA, but all of the required boxes, plastic bags, posters are drop shipped at the Cumberland County Jail. And then we have volunteers that actually go out to all of the sheriff's offices and deliver all of these necessary equipment about a month prior to each event. Once the medications are collected on drug take back day, dropped off at the jail here at Cumberland County Saturday night, on the following Sunday, members of federal drug enforcement, Maine drug enforcement, some deputies from York County, usually a lot of deputies from Cumberland County, will take the medications on Sunday morning to Eco Maine, where they are thrown in a hopper and incinerated. Again, some of the research done prior to drug take back, within the first couple of years of drug take back, I've heard people talking about the unused medications being shipped to Massachusetts. That did happen for the first couple of drug take back events. In fact, I think it happened about midway also, because Eco Maine had to shut down for annual repairs and cleaning. But generally, all of the medications are taken to Eco Maine, and they're incinerated at high temperatures. I really have to applaud Mike Wardrop and Hughes, who was the environmental manager at Eco Maine, for really doing the study on whether or not these medications could be burned at a high temperature and be safe for the environment. Because again, you know, when I was growing up, my mother always said, you know, you flush the medications, you know, in the toilet. Well, eventually that makes it back out into the groundwater, et cetera, and it becomes really problematic. So we definitely want to get the medications out of the medicine cabinets, because we don't want kids, young kids getting in there. And a lot of these pills, they're colorful. They're in a plastic container. If you shake them, sounds like a rattle. You know, they're going to be infatuated with playing them. And that's how unfortunate overdoses. You also have the teenagers that are in the medicine cabinets, and then the people really looking for medications that they can't buy on the street. So they target people who have medications lined up on, let's say, their windowsill in plain view. So for law enforcement, we are behind this 110%. I think I talk for all law enforcement. that the current drug take back is great, but it's only as good as our local, state and local partners stay involved, or our federal partners stay involved, because the federal government actually pays for the destruction. And that's pretty expensive. In my testimony, I talk about the fact that, we continually collected medications, even though I always say every day is a drug take back day, because most law enforcement agencies have a box where somebody can come in 24 hours a day and dispense of the unused medications. And the police departments will box it up and store it under lock and key. We did that for some period of time until we got accredited through law enforcement, and we could no longer be housing that in our evidence locker, if you will, because that didn't meet the criteria. So we looked at, if we box these up, can we take them right to EcoMaine? Because we're lucky, it's in our backyard. But it was pretty cost prohibitive. So what we ended up having to do is find another location to lock it up, alarm it, and make sure that it was kept. And we just roll that into the next drug take back. The other things that are out there that we find is nursing homes and long care facilities. They have no way of getting rid of their unused medications as well. So we have a deputy assigned that when somebody gets enough medications they want to get rid of, we send somebody over there, they grab the medications, and we put it in the boxes and store it for drug take back. So we are 100% behind continuing the drug take back. We agree that twice a year is probably not enough, but we have also seen, and we do a lot with WGME prior to this, just kind of making sure that the word gets out. Every drug take back is netted about 20,000 pounds of unused medications. That's 40,000 pounds a year. It's put Maine per capita #1 for unused medications, which it's a distinction that nobody really should be proud of, but it's a reality that there's a lot of unused medications out there. So we support that, and I'll answer any questions, and thank you for listening to my testimony.
Thank you, Sheriff Joyce. Since you are unlikely to be able to make it to our work session, why don't we allow some more generous questioning at this time for the law enforcement point of view? I would ask Representative Hanley, do you have a question?
Yes, I do. Thank you, Representative Tucker. Thank you, Sheriff, for your testimony. A question I have is
You muted, sorry.
all right, you didn't hear any of that?
No.
Okay, sorry. Thank you for your testimony. You mentioned the federal program, federal involvement is helping take care of this. Is there any federal program nationwide that's going on that you're aware of?
Yes, this is a federal program that DEA sponsors. So every day, every National Drug Take Back Day, that is occurring in the other 49 states. And like I said, the destruction part of it and some of the logistical part is picked up by the federal government. We do not get reimbursed for our overtime, but this is kind of like peace in the Middle East. How can you be against it? So you put a lot of effort into making sure it's staffed. So I don't know if that answers your question.
Okay. Senator Berner.
Thank you so much, Sheriff Joyce. I'm not sure if you'll be able to answer this for us today, but if you could send along this information to our analyst. I'm curious if you have a line item in your budget for the state or for the different counties for this activity.
I can tell you from our perspective, we don't. We probably should, but we know that we're going to staff it at 3 locations, actually 4 locations on that day. So that just comes out of our general overtime. So, it's automatically figured in that we're going to do it, but it's not a separate line item. I'll have to find out about the other law enforcement agencies.
Thank you.
Representative O'Connor. Representative O'Connor? You'll have to unmute yourself.
Sorry, I disappeared from the screen. all of a sudden I was there, then I wasn't. Thank you, Sheriff Joyce, for your testimony, and thank you for your service to your community. My question, I heard you say that you do a drug take back of 40,000 pounds per year, which is awesome. I was wondering if perchance you know or someone else knows the overall amount, the actual poundage of drugs that are sold in the state of Maine, and out of the poundage of those drugs that are not ingested, besides the 40,000 pounds, how many would be left over that we would be looking to capture in a program like this? Thank you.
I don't know. I can't answer it right now. I can tell you I'm working with Mike Wardrop very closely. He's reached out to the University of New England, and the pharmaceutical program over there did some research a few years ago. So I'm going to reach out to him and see if I can get a copy of that study that might be helpful. Might answer your questions. I can't tell you if it will or not. I can tell you that what I didn't say is I used the average of 20,000 pounds. There was one occasion where we topped 30,000 pounds in one 6-month period of drug take back. So, you know, after 10 years, I'm often saying that just when you think it's going to trickle off and it's going to go down, the numbers stay the same, you know, of unused medications. I know somebody else mentioned, I want to get that in there as well, veterinary medications. We're starting to collect those as well, because that's a problematic issue to get rid of them, first of all. And believe it or not, there are people that will use veterinary medications if they so desire. So that's both a concern for substance use, but it's also a concern for the ecological destruction of that material. But I will see what I can get for information on that from that study.
Thank you, Sheriff Joyce.
Senator Bennett.
Hi, Sheriff. Great to see you. Thanks for taking your time. Wanted to ask a question. And by the way, just on a parenthesis note, I do represent Harrison and Bridgeton and Sebago and Naples in your jurisdiction. I wanted to ask whether you, the Cumberland County Sheriff's Office, whether you're aware of any other law enforcement agencies in Maine that receive any funding, contributions, or any other funding in any other way from pharmaceutical manufacturers or pharmaceutical companies.
Not that I'm aware of for other agencies. I can tell you specifically for us, no. None whatsoever.
Thank you.
Representative Bloom.
Thank you, Mr. Chair. Welcome, Sheriff Joyce. Thank you for your testimony. I'm curious, do you foresee a role for Maine state law enforcement in the implementation of this program? Do you will you continue doing what you're doing on any level? And would you also be necessary to help remove the drugs or do any other kind of law enforcement aspect related to these drugs that the pharmaceuticals will now be taking care of?
So I have not read the bill in its entirety. So I'm a little guarded on that. What I will say is this: we are committed to making sure medications get out of the residences, out of the medicine cabinets, those unused medications. And as long as, speaking for myself, as long as we can do that and it's funded and it doesn't impact our budgets, we will continue to do that. It's that important. I would have to look at the bill to see what it would require for law enforcement to do. But again, my guess is if it doesn't cost us a whole lot, other than maybe assigning people periodically to take care of this, I don't foresee it being an issue, but I'd have to look at the bill to see what our lift would actually be.
May I follow up, please?
Yes, go ahead.
So you would say that this is just going to help alleviate some of the burden that you have taken on in Maine, that this is going to alleviate some of your burden that you've had. And
that's good. You know, like I said, in my mind, every day is a drug take back day. You know, I'll tell you right now, we've got a box in the lobby of the jail I tell people 24 hours a day, you can drop it off, no questions asked. So anything that's going to continue this process, it's really, again, without looking at the bill in its entirety to see what our role would be, there's got to be a backup plan, because you never know when the federal government is going to say, well, you know, we're no longer going to fund the destruction of this medication. So it would be nice to know what the future is. It is important as a sheriff to make sure that just like we're responding to emergency calls, if people have unused medications and they want to get them out of their residence and they can't make it to a drug take back, or they can't make it to the local police department to drop off their medications, I'll send somebody out to get those medications. So there is a commitment.
Yeah.
I just don't know how that's going to line up with the bill. So I'm a little guarded, but I can't foresee us saying, no, we're never going to be involved. Okay. We're supporting it unanimously.
At this point, I'd like to go back to Senator Carney, because we're all thinking about this issue of the question to Sheriff Joyce on the narrow question of, does the bill give a role for state for law enforcement in the take back?
Thank you for the question. So it does not preclude the current drug take back days, but it does create a separate system where the costs would be borne by the manufacturers rather than by the local and county and federal law enforcement agencies.
Okay.
There is a role on the part of, in particular, the US FDA in processes for collecting and disposing of the medication. And I actually would like to do a deeper dive into that and present that information at the work session, because it's a complicated question and I just can't answer it at this time.
Well, Sheriff Joyce, nice to see you.
Thank you. Have a great day.
We're going to move you back to being an attendee now.
Okay, thank you. Have a good day.
Okay. The next supporter that we have is Sarah Nichols from NRCM. Is Sarah Nichols in the house? Okay.
Here I am. Can you hear me okay?
Yes.
That's great. All right. Well, good morning. Nearly afternoon here. Sorry, I'm just going to move this on my screen. So Senator Brenner, Representative Tucker, and members of the Joint Standing Committee on Environment and Natural Resources. My name is Sarah Nichols, and I'm the Sustainable Maine Director for the Natural Resources Council of Maine. And I really appreciate this opportunity to speak to you in support of LD8, which would help Mainers dispose of unused drugs safely and for free. NRCM is a very strong advocate for extended producer responsibility, or EPR programs, which require producers to assume responsibility for the post-consumer recovery of their products. Such policies are fair, appropriate, and effective way to manage problematic wastes. Maine's Product Stewardship Framework Law lists 5 criteria to identify which product categories are prime candidates for a stewardship program. And while only meeting one of the criteria is sufficient, unused drugs fits all 5. And during the 129th legislature, NRCM worked closely with Senator Gratwick, industry experts, and pharmacists to develop language for LD 1460, which was, of course, the predecessor to LD 8. This committee held a public hearing, held the bill over, the public hearing was held in 2019, held the bill over to 2020, then amended the bill, reported it out of committee with unanimous support. And unfortunately, the legislature's abrupt adjournment last spring prevented LD 60 from being enacted into law. LD 8 is the exact same bill that was unanimously approved by the ENR committee last year, and we hope that you will similarly provide unanimous support for the bill this year. And here's why. The bill would create a reliable, sustainable, and convenient statewide collection program for unused drugs, which has important benefits for Mainers. I'm basically going to summarize everything that everybody's already said. So we'll decrease the risk of accidental poisoning and drug overdoses by preventing unused medications like opioids from accumulating in homes and getting into the wrong hands. It will offer an environmentally safe alternative to landfilling or flushing of unwanted drugs. Without a convenient and well-established alternative, pharmaceutical chemicals can accumulate in our waters through the wastewater treatment system or in a landfill leachate and pose serious threat to people and wildlife. It will relieve Maine communities, law enforcement agencies, and others from the burden of organizing and staffing sporadic collection events for unused drugs, saving time and taxpayer money. And it'll provide a standard way that Maine people can dispose of unwanted drugs so that they know what disposal options are available to them throughout the year. So 6 states have already established successful producer-funded take-back programs. This is Massachusetts, Vermont, Washington, New York, Oregon, and California. 23 US cities and counties have also done so. And there is proof that managing these programs costs manufacturers only pennies on a prescription and does not increase the medication costs for consumers. So for these reasons, we urge you to support LD8, and I thank you for your time and consideration, and I'll be happy to answer any questions you might have or help you find the answers to them if I don't know.
Questions for Sarah Nichols? Thank you very much. Oh, wait a second. Hang on a second. We have Senator Bennett.
Thank you very much. Yeah, I can see my hand very well. Ms. Nichols, thanks so much for your testimony. I was wondering, I asked the Sheriff Joyce this question. I'll pose it to you. Are you aware of the pharmaceutical producers contributing to any organizations in Maine for the disposal of their unused medications?
Not that I'm aware of. Doesn't mean it's not happening. Yeah, so that's a short answer. I think my my expertise in this particular area is really on extended producer responsibility and not necessarily pharmaceuticals.
Okay, thank you.
Further questions? Seeing none, let me just check. Sometimes the hand merges into the background.
I'm scanning too. I don't see anything. Thank you.
You're free to go. Thank you very much. Is Ann Hughes from Echo, Maine here? Good morning.
Hello. Yes, indeedy. I'm Dr. Ann Hughes, the Environmental Manager of Eco Maine. Senator Brenner, Representative Tucker, and distinguished members of the Joint Standing Committee on the Environment and Natural Resources, I'm providing this testimony as Eco Maine is neither for nor against legislative document number 8. Eco Maine is a municipally owned organization located in Portland that provides solid waste and recycling services to over 70 communities in Maine. Eco Maine's waste to energy facility has a license issued by the Maine DEP in 2015 to allow the secure destruction of non-hazardous expired prescription drugs, unused pharmaceuticals, and personal care products collectively referred to as PPCP. Eco Maine is licensed to combust PPCP as part of daily business. Eco Maine has also participated with the federal DEA semi-annual take-back drug events with the Maine Sheriff's Association by serving as the secure disposal facility of over 60,000 pounds of collected drugs annually. Based on empirical research conducted in conjunction with the Bureau of Air Quality in 2013, the stack test results illustrated low detections of air toxics from the 173 PPCP indicator chemicals that were analyzed. In addition, the Bureau of Remediation and Waste Management collected ash samples before and after the combustion of the PPCPs. And the ash results indicated a greater than 99% destruction of PPCPs during the combustion process. As the committee performs due diligence on this topic, I encourage the committee to review the Maine DEP findings based on their significant research. Eco Maine supports state efforts to responsibly discard unused pharmaceutical drugs and emphasize that the best method for destroying unwanted drugs is by way of incineration. Eco Maine is neither for nor against LD8. Thank you for the opportunity to provide this information on this topic.
Question for Ms. Hughes. Representative O'Connor.
Thank you, Ms. Hughes. Could you tell me, do you have the capacity to incinerate more than the poundage that you are already incinerating?
Yes. Eco Maine, as a waste energy facility, manages 550 tons per day of municipal solid waste. I have notes here from the last incineration and thermal destruction of the drugs collected by Michael Wardrop, federal DEA, and Kevin Joyce of the Maine Sheriff's Association in their collection event on October 24th, 2020. So here at Eco Maine, the next day, that Sunday, we actually combusted 30,000 pounds, and that was not a problem. That was over just a couple of hours.
Thank you. Excellent capacity.
Okay. Further questions about combustion of drugs? Okay. Representative Bloom.
Thank you. Thank you, Ann Hughes, for being here. But is it true that you need to combust these pharmaceuticals separately from other waste? Or can you combine it with other waste and no problem?
Yes, you can combine it with all waste. The BTU content, we greatly benefit actually from the plastic and cardboard in the packaging of the PPCP.
All set? Well, thank you.
Okay, my pleasure.
Wait a second. We have one more question for you. One question always leads to another, you realize.
Thank you.
Senator Brenner.
Thank you, Chair. Ms. Hughes, is there a way to differentiate in the tonnage that you're referring to what is packaging and what is product?
No, I mean, the way we handle the secure destruction, it's coming in the boxes. They get broken apart a bit by the grapple as the crane operator is moving the waste into the hopper, which incidentally is being scrutinized by Michael Wardrop and the crane cab. But I can also direct you to lots of data provided when Ann Pastel worked at the Bureau of Remediation and Waste Management, where during those mail-in drug and collection events, they literally counted like every pill that was available. So it could be instructive to look at some of those data and maybe answer some of your questioning.
Thank you so much.
Yeah.
Okay, thank you very much.
Thank you.
And the next person to testify is Mr. Leonard Blanchette, who is with the Maine Water Association. I might have that name wrong. It has, Mr. Blanchette can clarify for us. Are you there, Lenny?
Yes, I am, Representative Tucker. Can you hear me?
Yes, I can. Do you know how to find the video button?
Yes.
Okay.
Thank you.
Sorry, I butchered the name of your association.
That's okay. We will take care of it for you. Thank you. Good afternoon, Senator Chair Brenner, Representative Chair Tucker, and members of the Joint Standing Committee on Environment and Natural Resources. My name is Leonard Blanchette, and I am offering this testimony on behalf of the Maine Water Environment Association as a member of its Government Affairs Committee. I am also the General Manager of the Brunswick Sewer District, which serves the towns of Brunswick and Topsham, and serves as a septic receiving facility for more than 20 area communities. Maine Water Environment Association represents more than 700 members, including municipalities, sewer and sanitary districts, and combined utility districts, who are on the front line of keeping the waters of Maine clean through our diligent operation of sanitary and stormwater systems. A core mission of the Maine Water Environment Association is to promote professional environmental management practices to protect and improve the waters and related environments of the state of Maine. In furtherance of our mission, we offer this testimony in support of LD 8. We are aware of the issues and concerns with the improper use of the private and public wastewater systems as a disposal method for unwanted drugs and their effect on the aquatic life within Maine's waters. Any measure taken to remove or lessen their impacts will over time and in concert with other efforts make a huge difference. This legislation is long overdue. The Maine Water Environment Association and its members fully support this initiative to have the manufacturers, distributors, and retailers become part of the solution to the proper disposal of unwanted drugs. Contrary to public perception, our wastewater treatment facilities are not designed to remove and cannot remove toxic chemicals, petrochemicals, pharmaceuticals, pesticides, herbicides, and the many man-made compounds that we now understand to be problematic to public health and the environment. LD8 will help keep these pharmaceutical compounds out of the ecosystem. We hope the committee will join us in support of this legislation and vote a unanimous ought to pass. Thank you.
Thank you, Mr. Blanchette. I take it that you are in support or opposition or neither for nor against. Which category are you?
We are in support of LD8.
Okay. And does your organization include all the waste treatment plants in the state?
Yes, it does. Both municipal and some private ones.
Roughly how many are there?
About 460 facilities throughout the state of Maine.
Okay. Thank you. Any questions for Mr. Blanchette? Thanks for coming. Appreciate it.
More than welcome. Thank you.
Representative
Oh,
O'Connor.
we have a question. Oh, thanks for your help. Representative O'Connor.
That's okay. My question is, so asking the pharmaceuticals to do this and keep them out of the water supply, I think, I understand that. Does this open a door when you talked about the other multiple entities that wind up in these supplies in the water supply? Would this also eventually trickle down to other companies putting a cost onto their products to make, which will ultimately result in the consumers paying for this? Because every time any commercial industry incurs costs, they usually are directly put back onto the consumer of that product. So would this by chance open that up to other products having to pay for the proper disposals like this?
Well, I'm not clear who the question is for.
You.
Me. I hope so, to be honest. We get many compounds that come into the sanitary sewer system that simply don't belong there. But it becomes the easy alternative until we can all work together to find an alternative that's just as easy, but more environmentally sustainable. For us, it doesn't affect our cost to operate the facility. The wastewater treatment plants just don't have the ability to remove those from the wastewater. So we remove the bacterial stuff, the solids, as they were designed to do, and everything just keeps going through.
I understand that it would not increase your costs. However, overall, in the long run, it would increase all of the costs to the consumers who would bear those costs.
I suspect so, yes.
Pennies add up to dollars.
Is that what we call a rhetorical question?
I believe that was, Representative. What did you say?
Any other questions of Mr. Blanchette? Thank you very much for coming.
You're welcome. Thank you.
Now, the way I'm going through the list of attendees and moving them over has made it impossible for me to figure out who's going to be for and against, except those of where I've read the testimony already. So I might be a little out of order. So we took, for example, Ann Hughes was neither for nor against, but she came up instead. Now, the next witness will be Curtis Picard. And I believe his testimony was neither for nor against when I read it last night. We will get to the supporters shortly. Go ahead.
Thank you, Mr. Chair. So you're okay with me giving my testimony at this point?
Yes.
Okay. Give me a second here. Senator Brenner, Representative Tucker, and members in the Environment and Natural Resources Committee. I'm Curtis Picard, and I'm President and CEO of the Retail Association of Maine, and I'm also a resident of Topsom. The Retail Association of Maine has members statewide of all sizes, and I'm speaking to you today neither for nor against LD8 on behalf of our community pharmacy group members. As veteran members of this committee know, this bill was one of the most discussed and revised bills that I've ever worked on. This bill started as LD 1460 in the 129th, and it had 7 work sessions, was carried over, and was even reconsidered one time as well. It was a very challenging process getting to the language that is proposed in LD 8, which is identical to the final version that passed out of this committee in the 129th. I sincerely appreciate Senator Carney reaching out to me regarding this bill. We met at the beginning of January to discuss it, and I also spoke with the Honorable Jeff Gratwick yesterday. I told them both the same thing that I am saying today and why we're testifying neither for nor against. Pharmacists and Maine's chain and independent pharmacies have been on the front lines of fighting COVID-19 from day one. Healthcare is stressed to the max from COVID-19 cases, testing, and vaccines, and pharmacies are no exception. Early on, when Maine's economy was virtually shut down, Maine's pharmacies kept operating and handled a rush of customers seeking prescription refills when supply chains were disrupted and people were hoarding things like toilet paper. More recently, our pharmacists are focused on administering vaccines wherever and whenever they can. If you listen to any of Dr. Shaw's press conferences, you'll hear him talk about the good work pharmacies are doing to help vaccinate Mainers. With that being said, our members have told us that LD8 is just not a priority for them right now. We aren't opposed to the bill, but they neither have the time nor the energy to support an expanded program right now. They want us to focus on making sure they're recognized as healthcare providers and to make sure they're authorized to practice at the top of their licenses to help get us through the pandemic. This does not mean that the work of collecting and properly disposing of unused medications is not happening, as you've heard from other folks as well. Attached to my testimony is the result of Maine's recent Prescription Drug Collection Day in October. As you've heard, this event happens twice a year in Maine. Maine had 144 total collection sites, which measures up very well against states with much larger populations. As you heard, Maine collected more than 40,000 pounds of medications, compared to 31,000 pounds in New York and California's 52,000 pounds, or Florida's 38,000 pounds. Maine is always a top state for collection amounts per capita. In addition to these events, Maine has nearly 100 collection kiosks at various law enforcement and pharmacy locations throughout the year. I do have quite a bit of history with this bill, and I'm happy to continue to be a resource for you as you discuss it, and I thank you for your time.
I would anticipate some questions. Representative O'Connor.
Sorry, being new to this committee, I'm not sure what has or hasn't been answered, but thank you, Mr. Picard. It's really nice to see you again. Could you tell me why there's such a discrepancy with states like, I know Florida has a huge elderly population, lots of drug use, for good and for bad, but why such a discrepancy?
I can't speak specifically to why other states aren't collecting more, but I can tell you that Maine does a really, really good job of the collection events that we hold twice a year. So the participation from law enforcement and other entities has always been strong. I credit, Maine people and everybody being dedicated to these different collection programs, which, as Sheriff Joyce testified, for 10 years plus running, have really been a model for other states.
Thank you. We have some wicked good people here.
We do.
Further questions? Senator.
Me?
Senator Bennett. Yes, sorry.
Thank you. Thanks. Mr. Picard, thanks so much for taking the time to testify and your work on this prior to this session too. You said that you're not, that many of your members are concerned about sort of the timing of this. And I think I read in the bill that the effective date for the plans to be submitted by the manufacturers is 180 days after the bill becomes law effective. I'm wondering, do you recommend a longer period of time if the legislature goes ahead and votes this and passes it to be enacted? What would be a more appropriate time than 180 days?
I don't know. And honestly, we haven't been able to get our pharmacists together as regularly as we would like to talk about that because we are still under the state of emergency. So I don't want to shoot from the hip and say, you know, something I shouldn't, or that it should be once the pandemic is over. I just really want to communicate to the committee how hard pharmacies are working on the pandemic, which is why, you know, we probably can't come in and give our full-throated support for this either. They're really trying to focus on vaccines and being recognized as healthcare providers.
Fair enough, and I appreciate all the pharmacists are doing. If you could provide any further insight into that question for the work session, that would be beneficial to at least me. Thanks.
Yep.
Mr. Picard, what was the position of your association last spring when the committee voted in favor of this bill?
The amended bill, the original 1460.
As amended when we voted?
The final version?
Yes.
Yeah, no, we were supportive of it. It was, as you know, a very long road to get there. There was a lot of details and a lot of points that went through various refinements. I'm sure your committee analyst is happy that this version of the bill is identical to that version as well. So yeah, we did support that final version. I'm very happy that Senator Carney submitted this language.
Okay. Thank you very much. Further questions? Thank you for waiting around all day for this.
Okay.
Okay. Next person is Mr. Scott Cassell. Would you like to go live, Mr. Cassell?
Here I am. Okay, can you hear me?
Yes. Could you identify the organization you represent?
Yep, thank you very much. Thank you very much. Senator Brenner, Representative Tucker, members of the committee. My name is Scott Cassell. I'm the CEO and founder of the Product Stewardship Institute, and I'm here to express strong support for LD8. PSI is a 20-year-old national nonprofit organization, and we work to reduce the health and environmental impact from over 25 consumer products, including pharmaceuticals. So I have personally worked closely on developing every one of Maine's extended producer responsibility laws, and LD8 is no exception. I did work very closely with former Senator Gratwick and others to find the right balance so the bill could pass unanimously out of committee last year, and I greatly appreciate Senator Carney's interest in carrying this important bill forward this year. The heart of this bill is that it will be funded and managed by the pharmaceutical industry. This funding will alleviate the financial burden on retailers as well as municipalities, including the law enforcement locations that currently collect unwanted medications. There's all a cost there. The bill will also require retail pharmacies licensed by the Maine Board of Pharmacy to provide either a kiosk drop-off location or a mail-back envelope to their customers for safe drug disposal. Now, our organization spent 6 years leading a national effort to change the Federal Controlled Substances Act and the Drug Enforcement Administration regulations to allow the convenient collection of unwanted medications at retail pharmacies and other locations. Consumer convenience really is that important. It is an essential element of safe drug disposal, along with the extensive public education that this bill requires the pharmaceutical industry to provide. Now, mounting evidence demonstrates the need for secure drug disposal options that match the convenience of purchasing them. And Maine's drug take-back programs, and we've heard they're fairly extensive, but they are currently not convenient for residents. The drug take-back programs are considered the safest, most effective drug disposal solution by the vast majority of local, state, and federal agencies from around the country. 6 states and 23 local governments have already passed such drug disposal laws around the country, and we've worked with them all. They have all increased the collection of medications. And for example, the city and county of San Francisco saw an increase of 65% in the total medicine weight collected under an industry funded and operated EPR program as compared to the weight collected during a 5-year pilot. So 65% increase over 5 years, and a doubling in the number of medicine drop-off locations. And I have the data to provide to the committee for your work session, and I've worked with the operator of that program. So PSI has been working on developing safe solutions to drug take-back for 15 years. And LD8 is a sound piece of legislation that will help save lives in Maine and keep your water clean.
Very succinct. Thank you.
I
Any
tried.
questions? Representative Dudera.
Thank you very much, Representative Tucker, and thank you, Mr. Cassell. Cassell?
You got it, Cassell. Yeah.
Okay, great. Just a quick question. Did you have any data with rural states and how this program, went in rural states? A big city like San Francisco isn't really analogous to Maine, and I'm just curious. Thank you.
Yeah, good question. So rural areas are always a challenge for any type of program. That's why we discussed that quite a bit, if Curtis will remember, and Senator Gratwick as well. This program will be convenient to those in the rural areas mostly through the mail-back program. They don't have a retail pharmacy in every location. So we wanted to make it as convenient, but let's just remember there's only 6 states right now that have this program, and not all of them I would consider best practices like the Maine bill. The Maine bill is a best practice bill, and let's say Massachusetts and Vermont's bills that they have right now, or 2 other states, are not very good bills. New York has a good one that has not been implemented yet. Washington State has a very good one. California's is very good. And so there's ones that we would look at. Those rural areas will have convenience. That's very important to make sure that every resident has the ability to bring back their drugs to a convenient location.
Further questions? Senator Bennett.
Thank you, Mr. Chairman. Mr. Cassell, do you think that on page 4 at the bottom, if I recall, there's a section regarding the performance goals of the program? And I was wondering, given the experience that you cite in other states, whether you think those are realistic or should be amended.
I can't look at it's so much here. So I think I could respond in writing to that, but recalling the goals, there are ones that can be achieved. And there's awareness goals that are very important, because awareness and convenience are the most important things for effective programs.
Yeah, I think there were 60 in the first year, 70 the second year, and 90 in the 4th year.
Yeah, I think that was for the awareness goals. And I do think that those are achievable, yes.
Okay, thank you.
Okay, further questions? Thank you very much.
Thank you.
Next, we have Carlos Gutierrez.
Thank you, Mr. Chairman. Oops. I was worried this is I'm gonna turn off my video. I think it's on my end, not your end, and I'll just speak if that's okay.
Will you identify what group you speak for, if any?
Yes, sir. My name is Carlos Gutierrez, and I'm with the Consumer Healthcare Products Association in Washington, D.C.
And are you testifying for or against, or neither for nor against?
At this time, the way it's currently written, we are opposed to the bill.
Okay, go ahead.
So thank you very much, Representative Tucker, Senator Brenner, the rest of the committee. Apologize, well, not apologize, no one's there right now, but looking forward to the day when I can be back in Maine, beautiful state of Maine. We are not opposed to the bill because we don't think that drug disposal is not important. In fact, we think it's very important. Safe medicine storage, safe medicine use, safe medicine disposal are all critical components to a safe medicine use regimen. We're opposed to this bill because we just don't think it's necessary in the state of Maine, and I'll explain why. As has been discussed a little bit earlier, Maine has one of the most comprehensive drug disposal networks in the entire country, and you should be applauded for that. As it stands today, there are about 160 locations across the state which are currently serving Mainers' drug disposal needs. If you add to that the biannual drug take-back events in the spring and in the fall, where I think in the fall 120 law enforcement departments participated, then we feel there are more than enough options for people who are seeking to get rid of their expired or unwanted medications. As one might expect, these locations are in population centers where people live. And so as it stands today, half of Maine's population lives within a 10-minute drive to a take-back location. And 82% of Mainers live within a 20-minute drive to an existing take-back location. And those options are sure to increase as the number of chain drugstores and pharmacies, as Curtis was pointing out earlier, they voluntarily have pledged to increase the number of disposal options for their customers. So bottom line, we oppose the bill because we feel it's unnecessary. Take-back options already exist. And as was indicated earlier, it's more of a shift in cost to the pharmaceutical industry. For us, we represent over-the-counter medicine. We average about $8 a unit on the price of a medication. And so any little increase will translate to an increased cost for a customer. And for some, that's a big deal, particularly those that, live on the margins. This may be their only form of healthcare. During the pandemic, we really have been the first line of defense against common illness and common ailments, and really keeping people out of going to doctors' offices to address small issues. That said, I do want to thank Senator Carney. Senator Carney for being very open and transparent about this bill and working with us. Obviously, we came a long way from when this bill was originally offered. There are still some lingering issues that we'd like to work out with her, and she's indicated at least being open to those discussions. And so we would welcome that opportunity. She's been very gracious in hearing our concerns, and we'd like to continue that dialogue going forward. Thank you, Mr. Chairman.
Questions for Carlos? Representative Bloom.
Thank you. Mr. Gutierrez, thank you for being here. You mentioned what percentage of population is close to a drop-by place in Maine. I assume that you mean it's not, but it's maybe a drop-by disposal place that's only twice a year. What about, I think that part of this bill is to make it more accessible throughout the year. Is that correct? Is that what you're?
Yeah, my understanding is that these are existing locations year round. This is not the take back events. These are within law enforcement departments and existing pharmacies in the state that are already participating. I want to be 100% about that, so I will get you a for sure answer in writing. But my understanding is that, and we're basing this information, by the way, on the website myoldmeds.com. That's a website that the pharmaceutical industry is funding, and those are all verifiable locations. We actually call, make sure that they're still collecting medications, and that's how we did the math based on population. So my understanding, those are all full-time locations as of today.
Thank you.
Further questions or comments? We got finished a little earlier than I thought we would. Okay. Mr. Gutierrez, we are having a work session on this bill next Wednesday, the 24th at 10 a.m. in case you wish to attend.
I will try my best to be here.
Okay. That concludes the hearing today on LD 8. And with the permission of the committee, I'd just like to go through what the schedule is for the next week or two. The next time we gather together will be on Monday at 10 o'clock when we will hear 3 bills to repeal the ban on plastic carryout shopping bags. There are 3 bills and they will be heard simultaneously so that witnesses will come and they will testify, and they will testify on all 3 during one appearance. We will then go to the 24th, where we'll have a solid waste briefing by the DEP on their 23-page 2-year solid waste report, which is posted on the DEP's report site. It's an excellent report. It is not buried in bureaucracies. It's easy to read. And you will enjoy that briefing, I believe. It covers the universe on solid waste and the associated parties. In the afternoon at 1 o'clock, we'll then move into the work session. I'm sorry, I take that back. The work sessions are in the morning and the solid waste briefing is in the afternoon at 1. Then we move along to March 1st when we have 3 bills from the DEP, 67, 69, and 436. 67 deals with discharges in AA streams. The title has to do with salmon restoration. LD 69 deals with site location and allowing towns to do the site location work on projects of up to 10 acres instead of 7, which it is now. And then LD 436 deals with permits and fines allowed in enforcement proceedings by the DEP. So that will be a heavy-duty day. Then let's see. I should point out that the Senate confirmation for our DEP commissioner will be on the 4th, I understand. Is that correct? Have the senators heard anything about the Senate convocation?
It will be on Thursday, the 25th in the evening at 5 p.m.
Oh, thank you. The AFA has invited us tentatively to join them on March 5th at 10 a.m. for the DEP aspects of the biennial budget. It's the same routine that we went through for the supplemental, except now we're going to do it for the biennial budget. So those are the things that are coming up. And any other business that we want to discuss?
One question,
Go
if
ahead.
I may. That waste report, can we have that electronically transmitted to us?
Sure, I can send it to you right after the meeting.
Okay, thank
It's
you.
on the DEP site, and it's easy to find. I'll get that for you. Do you want me to mail you a hard copy, or do you want to just mail you the electronic version?
No, the electronic will be fine.
Okay. Anything else? Representative Bloom.
Thank you. Representative Tucker, you emailed a invitation to the SWANA presentation. I believe it's tomorrow.
Yes.
And is that going to help inform us? It sounds like it could be a good thing to do to help inform the solid waste report as well.
Yes,
That'd be good.
it's being put on by the association that deals with solid waste. Echo Maine is the one that's putting it together this year. They have a convention each year and they have training sessions. It's particularly meaty. It's a good session to go to. It will get you familiar with the parties involved and what they're thinking about. It's the haulers, it's the landfills, it's the waste processing people, it's the recycling people, that whole community of interrelated entities that deal with solid waste. I would recommend it highly. And you just get hold of Echo Maine, they can get you just get hold of Echo Maine and they'll give you the links and stuff.
Sounds like a really fun time, Ralph, by the way.
Yeah, it actually is. They want you to register today, though. They don't want to take registrations tomorrow. So if you have time and you got nothing to do, it's a good move, because solid waste is going to be quite controversial down the road in this session.
Will it be more fun than taxation?
Oh, I'll stay with the solid waste. Let you guys handle the taxation. Senator Brenner, do you have any other anything on the to-do list?
I don't have anything on the to-do list. In advance of our work session on LD8, though, I do have a request for our analyst or any of our attendees today, if they have capacity to send it to us. I'm just curious about what the current cost of the programs that we administer as a state are to the state for drug take back.
Shall we
If that's a possibility to have for our work session, I would appreciate it.
Say, Dan, can we bring you in and say hello to you? How are you today?
I'm good. It was hard to not talk for so long.
Did you get a long list of requested info from various people in the committee?
I certainly took notes on everything today. My impression was that information may be difficult to distill into a single number, but I can certainly reach out to some people that spoke today.
Thanks,
Are there
Dan.
any other persons here today, any other members who can think of anything else where Dan could make an inquiry for statistical or other information?
Yes, I do. Back to this, the availability of what we currently have that's open 24 hours or open every day, whatever it is. He cited a website. I just wanted to make sure I had that website, or if those numbers that he cited could be checked, because it just didn't sound right to me, I guess. And he cited a site where he got that information.
Which witness are you referring to?
Mr. Gutierrez.
Okay.
That was discussed last time we took up the bill. It's My Old Meds. It's
okay.
It was compiled, I believe, by some of the pharmaceutical manufacturers. I have no way of verifying that information. I know you heard this year and also a lot last year from Scott Cassell with Product Stewardship Institute. He may have some input on that as well.
Yeah, maybe we should just double check that.
Okay. So is it time for lunch, everybody? Okay. I'll ask Sabrina to shut us down.
Thank you so much, Ralph.
See you Monday.
All right.
Okay.